Okay, Doc. So how do I get over depression or stress?
Okay, so depression or stress is a mental disorder. Not all stress, depression and stress are mental disorders that present in different ways. When we talk about depression, it's a mood disorder primarily. So the symptom will be a low mood or an irritable mood or disinterested mood. And when we talk about getting over it, different people they require different things. So when I see someone with depression, I'll assess them first, and then I'll categorize that depression as mild, moderate, or severe. So when we talk about mild or moderate, moderate depression, we say that a patient can be fully treated with maybe psychotherapy alone, but once it gets to moderate and severe depression, you often need medication as well as psychotherapy. So to get over it, I would say it's an illness just like any other illness, so you need to get treatment for it. People then do ask, do some people get over depression without any intervention? And it's very possible. You can have depression, often if it's mild or moderate, and if it's due to a specific psychosocial stressor. So by that I mean if you're depressed because right now you're having arguments with your partner, or maybe you've recently suffered a loss. As you resolve these arguments, or as time heals the loss, you yourself can get over the depression without any sort of intervention. But the risky thing as well is, just like you can get over it, maybe the depression gets worse. Maybe what started off as moderate depression becomes severe depression. And the severest form of depression is suicide. So I would always advise someone to seek help from a professional.
Okay. Is it normal for a person to see what is not there, like just seeing things?
Okay, so that would be what we classify or call hallucinations. So hallucinations exist in all sensory modalities. So like those five senses from creche, I hope, or primary school at the most. So what you see, hear, taste, touch, things like that. So when someone has hallucinations, if they are, let's say, auditory, which means coming from the ear part, they are hearing things others do not hear. So they are hearing voices that are not present. So maybe as a bystander, what you observe is that they are talking to themselves. Because if I'm hearing a voice that is talking to me, I would respond, and I'm a talker. Or somebody can have hallucinations that are visual. So maybe they're seeing things other people do not see. And then going back to that question, is that normal? No, it's not something that happens without another cause. So it needs attention. You can get hallucinations maybe if you've taken something like substances. You know, people who take illegal drugs, they may hallucinate in that period, and then when the drugs leave their body, the hallucinations may stop, or in others may not. Equally, you can get hallucinations if you're delirium, which is that maybe you've got a severe infection, your fever is very high. I think you also see that maybe like little children or people who have, like, let's say illnesses such as malaria, when their temperature is high, they get hallucinations. But in itself, hallucinations are also part of a mental sort of symptomatology that we call psychosis. So once you're hallucinating, that's when we call someone has psychosis, and that's a severe mental disorder, and it can exist within all the disorders. So you can get depression with psychosis. You can get schizophrenia, that's a psychotic disorder. You can get bipolar affective disorder and be psychotic at that time. So the hallucinations still are a symptom of, a mental disorder that you then have to diagnose. And that is not normal, and you need treatment.